Hi people, hi. This is Sila, your therapist from Sila Counseling and Mediation. And this evening, I'm just here to sensitize us a bit about an issue that is actually affecting some parents, of course, because of their children. And this is about developmental disorders. Now, when a mother conceives, or when a couple get to a place whereby the wife has conceived and they're looking forward to a child, we all look forward to a normal child, a child that will be born, a child that will develop well, that will adapt well to school and grow up into a very responsible, a mature citizen later on in life. But sometimes you find that that is not the issue. So sometimes you find that you give birth to a child, and when this child comes, on earth, they come with some myriad of issues. That is where you find that some children are born normal, some are born with autism, some are born with attention deficit hyperactivity disorder. Some of them have intellectual and learning disabilities. It's not the wish of these children. And you find that sometimes some parents take quite some time before they notice that their children are actually having such kind of developmental disorders. For some of them, they come out so clearly right from childbirth. But for some of them, they kind of hide until when you find that a child has reached an age-oriented milestone, and the child is not actually able to negotiate that milestone. That is when you actually come to realize that a child actually has a problem. Maybe this child is supposed to develop language, but they are taking forever to develop language. And you come to realize this child is at the age where they should be able to take care of themselves, maybe wipe their nose, maybe spit out and all that, but they're not able to do that. So that's when you realize this child has a problem. So when you go to the doctor, they send you for diagnosis with the people who have done special education and who know about these different types of developmental disorders. So when you go for diagnosis, there's placement whereby you'll be told this child is suffering from this kind of a problem. Now you find that these children may not be able to adapt well now like any other child. Sometimes we even force them to go to the normal schools, but you find that they're not able to cope with the other children who we can call normal in quotes, because even these other children are supposed to be perceived as normal, only that they have some kind of disorders. So